Hi, I'm Maureen Larkin. Welcome to Sundance Traditional Chinese Medicine. Today we're here to talk about constipation, which can be a terrible issue, especially for people who've had surgery. Did you know that constipation is one of the most common post-surgical issues that people face? This can occur because prior to surgery, your fluid intake may be reduced, and of course, during the surgical process and afterward, you've been taking painkillers, often opioid-based painkillers, which can cause dryness, and there you have constipation. Now fast forward to the day or two after surgery, and your care team comes in and tells you that you can't be discharged until you move your bowels. Well, there's a little bit of panic you have to deal with, in addition to the fact that you've got opioids in your system that are causing your bowels to back up. So today what we're going to do is look at some acupuncture points that you can use acupressure on, or maybe a person who's there taking care of you can do this for you. And a little bit of self-massage on these points is going to help you to move your bowels and take away that panic that you felt just a minute ago. In order to locate the points that we're going to use today, we're going to use our hand, or rather the hand of the patient, as our measuring tool. Now, if you use a hand to locate that is significantly larger or smaller than the patient's, you will end up in the wrong location. So either use the patient's hand or make sure that the other hand that you're using as a substitute is of the same size. Our first measurement is what we will refer to as a measurement of 3. And to arrive at the measurement of 3, we're going to take 4 fingers of the patient's hand together, and approximately at the level of the middle knuckle. This is our measurement of 3. The point we're locating first is called Sanjiao 6, branch ditch, and it's located by following between your index finger and thumb up a measure of 3. So what we'll need to do is take the edge of our pinky finger and lay it at the wrist crease. When we do that, if you follow up from between your thumb and your index finger, you will arrive at branch ditch, Sanjiao 6. Once you've located Sanjiao 6, simply apply gentle but firm pressure to it, and you can hold that pressure for up to a minute or so, or you can press and release. Do this for an interval of about 5 minutes, and then wait for a little while and repeat it. Your bowels should free within a few hours. A second point that's helpful is located in a 2-step process. First, find a measure of 3 directly below the center of the patient's belly button. Next, you're going to move to the side, either right or left, by a measurement of 2, which we find by using 3 fingers close together. At the outer edge, you will be at stomach 25, celestial pivot. Massage this point with gentle yet firm pressure, as described earlier when we were talking about the point on your forearm. Note that on your left side, this point happens to be located directly over your sigmoid colon. Thank you for joining me today to talk about the very common issue of constipation, and of course, especially to talk about post-surgical constipation. If you have any questions or comments, please do feel free to get in touch with me at Sundance Traditional Chinese Medicine.